Good morning. Today is January 20th of 2023. It is Friday. It's 11:04 a.m. This is Coffee with Community Services, Alta California Regional Center's weekly vendor meeting. And I hope everyone's doing well. We've got 69 folks on today. Got a little bit of an agenda of items. A shorter week, Martin Luther King Day on Monday. So we've got some staff on here, and so we'll introduce some folks and get going into our agenda. So to start off, I see that we have some folks from our community services department. So we have our HCBS specialist, Alicia, on, who's going to be meeting with you all a little bit later and sharing the updates on HCBS. And we have our employment specialist, Carly, on here as well. And Jason and Gary from Community Services, and Scott, our QA in Community Services. And let's see, we've got my assistant Zach on, and Heather, who has been certainly very busy for the last few months, working on providing increased monitoring of our adult residential facilities for people with special healthcare needs. And so good to see Heather this morning as well. And I see Dee Dee on as well, and Shirley and Leah's on. And let's see, we've got our managers on. I see Helen on here, and Rima from Community Services is on this morning as well. Good morning, Rima. Rima, just a heads up, I'm going to ask you to talk about the upcoming sign language class, the free sign language class that is being offered through Placer County Office of Education. I've got the flyer, so I'll share my screen, and if you would not mind, because I think you know these people and I don't. So, and then also I want to take a moment to talk about, we made some changes to our CPP plan for the deaf and hard of hearing services, the registry and the translators. And so maybe you and I both can go over that project that we are proposing to DDS today too. Let's see, we've got additionally some client services managers on. So I see Heidi this morning. Good morning. In the Grass Valley office, and Christy from our community services department's on, and Dana and Christina, our client services managers. Good morning. And Veronica out in Woodland. Good morning. And let's see, who else have we got on here? Associate Client Services Director Tracy Brown's on, and Client Services Managers. I see Faye. Good morning, and Cindy as well, and Shirley from our Community Services Department. I don't think I said her name yet. Introducing her. And Jennifer Bloom is on, our Associate Client Services Director, soon to be in 10 more days or so, Client Services Director for our regional center. And Camelia, our clinical director, is on here. Also been very busy, Camelia has, with a number of different issues, dealing with some care of clients, and also certainly some of our medical facilities with our regional center as well. And let's see. Damien, Helen, have we introduced Damien yet? Let's do that right now.
Not yet. Yeah, so Damien is our new community services and support staff specialist, and he's handling transportation, durable medical equipment, environmental accessibility, interpreter, and some others. And so Damien, if you can please go ahead and talk a little bit about yourself and your background, and your new job. Right.
Thank you. As she said, my name's Damien. I actually transferred over from a service coordinator position. Some of you I know, some of you I just recently met, and others of you I'm hoping to meet pretty soon. For the last year or so, I was a service coordinator in the Roseville area with the adult unit. And previous to that, I have a extensive business background working in everything from public relations, marketing, project management, operations improvement, and so on. I'm hoping that those skills translate effectively over here, and that I can be up and running quickly and be of good use.
Excellent, and welcome, and certainly happy to have you as part of our team here. Welcome, Damien, to all of our vendors as well. This is not certainly all of them. We got about 1,000 service providers that build a regional center every month, but about 80 or so of them are on here right now, and consistently log in to find out about all these crazy changes that are constantly going on over the last couple of years. I saw Rowena popped on as well, and so I wanted to say hi to her too. And I saw Wyatt Stroman. I thought I saw on there too. And Wyatt has recently been promoted to a client services manager, and so we will say congratulations to Wyatt, who's on here. And I see Michelle Johnson, our director of client services. Good morning, and Michelle McDonald, who I'm going to make a co-host of this meeting, in case my computer decides to have issues like it did a little bit earlier today. And Adriana and this morning from our community services department, and Reva, our client advocate. Good morning, Reva. So for the agenda today, we've got a few different things that we are going to talk about. I certainly recognize that we have a large number of transportation providers that are in this meeting. We typically have some transportation providers, but more, I think, recently because of the correspondence that we've been sending out. So certainly we will be following up with a discussion here this morning related to the transportation monthly rates, and then also Michelle McDonald's going to remind me to make sure that we discuss that in the context of the 880 vendors as well. So quality incentive payments for DSP surveys, we're going to talk about that. We're going to talk about updated rates for people. We're going to talk about the transportation process, kind of how we're looking at the next steps as it relates to transportation providers and implementing these monthly rates. We'll do an update on the CPP plan kind of status. Alicia's going to provide an update on HCBS and also our HCBS grant project with Carol Watillo. If Carol's on, she might be able to chime in about it as well. We're going to go over the 1 to 3 COVID residential supplemental staffing and what our plan is as it relates to those. Share a little bit from our dear friends at the Federal Department of Labor for some things that we found out recently, and then a little more of an update about coordinated family support services. I know many people have heard about this. I know there was a webinar a few months ago, and so an update about the coordinated family support services as well. As per usual, if there's additional things that you want to talk about, please feel free to drop them in the chat. I know I will tell you I was out of the office yesterday at the ARCA meetings all day long, and so got to spend some time with the other regional centers and hear what's going on there with their regional centers as well. And certainly many of the challenges that we're facing here in our area are going on throughout our service system, and many of the challenges that we're hearing related to rates and the rate study implementation and the communication around that are also things that statewide are certainly an issue. So maybe talking a little bit more about that meeting as well. So one of the things that we learned from Robin LeMay from our accounting department is that the quality incentive payments, this is when you did your DSP surveys as service providers, and then you got to have, I think it's an $8,000 payment for filling those out. We have paid out all of them. So all the ones that we had have all been paid out by our department. That's the third list that we've received. So we had the first list, second list, and this was just the last one. And Robin mentioned that we've now paid out all of those. So if there is some type of issue and you believe that you should have received a payment for that first run of the quality incentive payments, please reach out to your specialist. We can try to get it figured out with our accounting department. Some of you may be aware of this that have been following the quality incentive things, but there is going to be another opportunity in the future to do this again, kind of like a follow-up survey as well, which if you did the first survey, you'll have an opportunity to do the second survey. If you didn't do the first survey, I think you have an opportunity to do the first survey again when they rerun it for people that may have missed it around the first time. I think there was a lot of representation from you all in there. Our provider advisory committee was very vocal about encouraging folks to fill that information out. Right before COVID happened, Dr. Ghali, who's the secretary here for Health and Human Services, came to Alta California Regional Center, was down in our lobby, and he talked about data-driven decision making. That was a big discussion, and that was kind of the way of the future that we have heard, and we've certainly seen that more and more from our state partners. And so again, when you guys are willing to take the time and fill out surveys, if you're willing to take the time and do that, it does give them really good information and a snapshot into what it's really like to run your businesses and kind of some of the stressors and challenges that you guys face. So again, I just want to encourage folks to communicate as it relates to these things. And as there are more opportunities for the quality incentive surveys, we'll make sure that we update everyone on that. Any questions about the DSP surveys? All right. Okay, so some of you are aware that there is on the residential side of things, and we've got 102 folks on right now, so there's certainly a number of residential providers that are on here as well. So we have updated P&I and SSI rates. Those have been done. So the P&I and SSI rates went up, thank goodness, and so those have already been inputted. The ARM rates and the January rate increases, so the rate increases that all of you are getting if you are slated, if you've got a rate increase previously, will be going in next week. So next week we're going to be putting all those in. I believe it's going to be the 23rd, and then that's going to give our accounting department time to get everything processed so that you guys can all do your billing for the month of February, in the beginning of February for the month of January, and be able to have your updated rates in there. So we're doing our very best. Certainly, if there is any issue, I feel very confident that you as service providers will let us know if your rate increase does not calculate and you're not able to see it on your billing. I think the first step, most of you know who your bill payers are within our accounting department. And so if you received a rate increase and for some reason you did not, I'd encourage you to reach out to your bill payer, and you can also CC your community services specialist, and we can find out kind of what the issue is. Again, at this point, it shouldn't be as challenging as it was before because the math's already been done. It's just adding an additional percentage on. So that is all happening next week. So you will all be good to go as it relates to that. All right. So the next thing I want to talk with folks about is a couple different things. One is there was a letter that was put out by me, and it went out to all of our Service Code 875 service providers. Service Code 875 is closed transportation providers. So we have learned from the Department of Developmental Services, and I'm going to share my screen real quickly to DDS's website. So one moment here.
Get started by searching for your favorite artist. Then personalize your listening experience by.
We are not going to be personalizing anyone's listening experiences. All right. So you guys are seeing DDS's website now? Perfect. Right here, the very front, directives to regional centers. And there's some updated information related to the quality incentive programs. And so we can certainly talk about that a little bit more. But right down here is the transportation services monthly reimbursement rate. And this is zoomed in very well, apparently. I don't think I need that much. Sorry, 1 second. Okay, so again, this is the, there it is. That's what I was trying to focus on. This is the directive from the Department of Developmental Services that allows for the transportation services. Once again, I want to clarify that this is allowable for both Service Code 875 vendors and Service Code 880 vendors. So that supplemental transportation that goes on day programming. Maybe it's attached to a home as well. What you are able to utilize are the alternative services rates that existed during the pandemic. In essence, you were all, the 875 vendors that were around previously had alternative services rates that were calculated by looking at the amount of service that they were providing monthly prior to COVID-19 state of emergency being declared. And what is allowable or available now is if you do not want to provide transportation in a traditional billing manner, and again, the transportation itself still needs to be traditional. There's no alternative services left anymore. This is only a monthly billing reimbursement rate methodology. It is not a change to, in essence, what the services that the provider is actually providing. So again, this is not bringing packets out to people's homes and things like that. This is providing transportation. However, you may be able to bill for a full month of your alternative services rate if you do at minimum 19 trips. And again, that is like 2 days a week of day programming, basically, in a month. Maybe 3 days a week of day programming over a month. 19 or more trips. Again, it's works out to 9.5 days. So I mean, we're not talking about a lot in a 23-day month if people are going full time. So for transportation providers, this is an opportunity that you've been given to be able to bill this way. What we've done is we did a certification form that allows the providers to say, yes, we are willing to provide the transportation services as outlined in the directive, and we'd like to be signed up to do this. At that point, once we receive the information, and I know I already had one provider yesterday that told me that they are going to switch over to the monthly reimbursement rate. Then the next step is that after we get the sign now verification, and that was the thing that was included with this, is that you cannot bill for these monthly reimbursement rate claims unless you have a certification statement, basically, that's saying that you're going to provide the services as outlined, in the directive that we showed there on DDS's website. So we are going to take that information from the Sign Now surveys that came out from each of you. We will then take that and give it over to accounting, and accounting will create a new rate for you on the rate table. After that, we're going to ask you as service providers to connect back with our service coordinators and talk with them about what the specific need is, what is the amount of service, what the needs are. And then from there, we'll work on, switching those authorizations over. But again, each of you transportation providers that have a desire to possibly switch over to the monthly reimbursement rate are going to need to get in contact with those clients and planning teams to talk about that switch that you're going to be making. And you're going to need to be informing the service coordinator very clearly what the number of trips that are going to be going on during that month are, because they're going to need to know what kind of authorization to write for you. Are they writing an authorization for the full amount? Are they doing it for 3/4, a half, or 1/4? So we're working on some written instructions for our client services managers, and we kind of have the written instructions for our client services managers, but we're not going to get into all the specifics until we have an opportunity to share it a little bit more with our client services managers, the actual activities of the service coordinators. But the main beginning steps are, we've already sent it out to the 875 vendors. You should have received that Sign Now link that can be utilized. And yes, Tony, thank you for your question in the chat. This can be retroactive back to the month of January. So if a provider, the only thing I would say is that if we haven't got this going, please don't bill for the month of January for the traditional services and then turn around and say, oh no, I want it switched back to something else. Let's, as soon as possible, if you think that you are going to do this, we need you to contact us and let us know so that we can update things. And we recognize that the department set this up effective January 1st. And of course, the memo didn't come out till January 6th. And, it takes a little while. Over this last couple of weeks, we've been trying to operationalize how we're going to do things. And also, there's a lot of, questions that are still out there. One question that came up, and I will make it very clear here too, is that if you're continuing to do the traditional services, you cannot do a claim separately for your actual fuel costs. The actual fuel costs can only be submitted if you are doing the monthly reimbursement rate that has been put on there. So let's see, to make it clear, you can bill for some clients traditional and other monthly. Yes, that is the case. So for example, if you have a certain amount of riders that are only going 1 or 2 days a week, and for those riders, it makes more sense to be fiscally on a monthly reimbursement rate as opposed to your traditional rate, then that might be the decision that you make. I will tell you, if you start mixing traditional and non-traditional clients in your same vehicle, which really wouldn't make sense anyways, because if they were in the same vehicle, they would probably all have the same classification for the number of days they're attending. I don't know. We'll have to figure that out a little bit, possibly. That might be a little bit of a nightmare to figure out with the way the rates for the traditional services are set up. But again, you do have the ability to be able to mix it, and we are right now just wanting each of our providers to know that this is an option for you to fill out that Sign Now survey and get it back to us so that we can have good conversations. You know, Helen, myself, our transportation folks, maybe accounting, we might want to be answering questions that you might have related to this. So we won't know about it unless you express an interest and do that. And just doing the Sign Now thing obviously does not commit you to the changeover of the authorizations, but it does allow us to kind of get the discussion started. And I will tell you, I'm not very excited about this. I'm very concerned about this limiting our ability to get back to some sense of normalcy. But I also, and I should say, I'm also concerned that there's not really anything in here to help preserve or save, per se, transportation service providers. There's no big incentives here to rebuild businesses. And again, I would have liked to have seen something like, you know, if you're willing to provide more transportation than what you provided prior to COVID, you can bill at a higher rate or something like that. To me, that would really incentivize us being able to get transportation back to where it needs to be. And unfortunately, we've seen the budget, and I'm not going to do another budget, discussion here widely, but we know that some of these big fixes that are probably needed to the rate study, like for example, I think first is transportation. I think ILS is up there really high as well. I know the department specifically brought up early start vendors as well, and the issues related to their rates too, statewide. And so, but there was no money really tied to the budget other than some money for increasing, I think it was like 10.1 million for increasing the
Because
IRS for
somehow
the IRS rate, I think.
she'd make it a conflict of interest.
All right, and so transportation providers, I'm gonna jump at the chat real quick. And Maisha said too, or just allowed to be able to bill for fuel as well. But again, that is not something that they have allowed for us. Other questions about the transportation process? I'll just tell you, we're going to talk about this again probably next week, because by then we will have more information we can share about our internal process at the regional center, because again, with a lot of the things that we've been rolling out, basically ever since I was telling folks that switch over, and our transportation providers would remember this, from the retainer payments to the alternative services payments. And we kind of put it in, service coordinators would remember this, of the managers. We put it on the service coordinators to make all those changes. And that was also at a time where we were also having staff that were leaving the agency, kind of great resignation time as well. And so there was just so much confusion when it came to whether or not someone should have an alternative services authorization or not when that all started. And it ended up with some providers going, months sometimes without having an open authorization for the services. So now when we're doing things like this switch over for a number of people, we really spend a lot of time looking at our internal process so that we don't have any clients that get left behind without that service, and that we don't have these disagreements between whether or not it was a planning team agreement or not. So again, the ADs and Michelle and everyone have kind of taken a look at our process, and we'll be looking forward at probably the next time to go over a little bit more specifics. Maisha, yeah, go ahead.
Just really fast. I know when it was alternative, you had to, go through the client or family to make sure that they were in agreement with this. Is that necessary in this scenario as well? Or is it just a conversation, because you're not changing the services? Is it just a conversation with the team at all?
It's not really a planning team discussion. I mean,
okay.
Honestly,
because nothing's changing,
unless you're planning on changing the type of service or amount of service, then that totally as a planning team discussion, but how we reimburse you for services, whether or not you end up doing a monthly reimbursement or a individual the traditional reimbursement. Again, as long as it's not going to impact the number of trips that someone's doing or anything like that, how you bill us, or the fact that we're allowing you to bill us in a different methodology for providing the services. Again, as long as it doesn't impact client services, it's not really that big of an issue. But if it is, and everyone day program, there are tons of day program operators on here, certainly would recognize that there are personnel issues and things like that certainly impact the services that we're able to provide. So for transportation providers, I just do want to encourage you to please communicate if there is going to be some change of service that's going to end up happening because of a decision that you are looking at making related to these monthly reimbursement rates. And again, at that point, the service coordinator, the planning team may also have to look and decide whether or not you will continue on as the transportation provider, or if we'll be looking for a different transportation provider as well. Yeah, that's a great question, Cindy. And I know I've brought this up in a number of different forums as well about the statement that is in the directive about transportation providers that are willing to provide services. And this is what it says in there. Providers are encouraged to offer services beyond the normal hours of operation and or their typical destinations, thereby increasing opportunities for individuals to access transportation services. So for example, if there is a one-off trip to a medical facility or something like that that's needed, in a situation like that, it has to be something that is, requested by the client, and if it's a modification from the service that was being provided previously. But yeah, Cindy, let's and Helen, we can have a further discussion with this. We can talk to our transportation providers and find out who is willing to offer services beyond their normal hours of operation. And again, I don't know that there's any incentive for our providers to do that based off of this type of billing methodology that's been set up. But I think, and Eric, I think talked about this last week, but that is a big push for the department though, is to have more flexibility in these types of, in this particular service. Eric, and I will say, I know there's a work group. One last thing real quick. I know there's a work group that is getting together with the Department of Developmental Services to kind of further flesh this out. And so I just want to share with folks that our Chief Financial Officer, Iqbal Ahmad, is part of that group. And so I know I gave him some feedback about the number of trips that are being required in order for this to be able to qualify for a full billing unit. And also whether or not we truly need to maintain this for a whole nother year or not as well are two questions that I have. Eric, I see your hand up. Please go ahead. I think we'll have you unmute though.
There we go. Yes,
Perfect.
I know that some of us had heard that they might put out an additional FAQ. I know I had suggested that they just put out a new enclosure for exactly how to bill, because there's questions about that. You're right, there's not a financial incentive except for the full unit rate should be more like 19 trips is typically less than full service that you would get. So the idea would be that that would be sufficient enough, and that providers now, if you're meeting your clients' needs and you're providing the needs of the program, that you're probably already providing services beyond what you normally would have in terms of hours or route modifications or locations, that kind of stuff. One thing we did talk about, and I guess I think this is part of the solution to this problem, is part of this, in order to do that monthly rate, if you want to do that rate, the individual being served has to be receiving the services that they need. And if a provider is not willing to expand services, add drivers, add vehicles, increase routes, we talked about that folks probably need to be, transportation providers who are not providing that service likely would start losing individuals on their service. So the idea of client choice pushing providers to provide the service, and increase services, I think was one thing we were hoping we would find in through this process in 2023. But you're right, it probably could have been better. I think it was what they could do, but it's certainly not enough. for us per trip, that's somebody coming on and off a bus. So that's pretty standard here. When somebody steps on the trip, it's not round trip, because a lot of folks get one-way trips on the bus, and then they step off a bus, that would be a trip. So yeah, that's just some of my comments. And the transportation work group hasn't met since that it's come out. We're waiting to see if they need additional guidance on things, and then the work group will get started on the rate study issue.
Excellent, thank you. And I see Johnny's on here, and Tracy's on here, and Michelle's on here. Again, we'll get into more specifics about our service coordinator process once we nail it down and get it all typed up nicely. But anything else that we want to remind folks as we're talking about this? Certainly we talked about being mindful of any impact on changes to client services or anything. But anything else that as it relates to transportation and the monthly rates or client choice that you guys wanted to talk about? Right on. All right. Well, in that case, what I will say is we more to come. Transportation providers, if you are like Open Door and you are not quite sure who is your community services specialist, I would just encourage, sometimes people will get good responses and quick responses from me, and sometimes they won't, based on the volume of responses that I'm giving out currently. So it always really benefits for you as service providers to get in contact with your specialist. Definitely one of our managers. Again, it's relatively, easy of a breakup. Michelle has, the adult and the residential services, employment type of services. Helen largely has the, the children's services, the therapies, transportation. And so, that's kind of the breakdown. And then Jordan has all of the specialized stuff, all of the specialized homes, specialized day programs, some of those types of things. So, again, just want to encourage folks, we want to make sure you're getting answers to things. And for you transportation providers, like right now is not a time where like you should be wondering what's going on and not being fully informed about things. So please take those opportunities, reach out to our staff. Many of our specialists are still new. Helen is certainly figuring out all of this stuff. We're all kind of figuring out the transportation stuff as it's constantly changing. But we'll do our very best to provide you the guidance that we can related to this. All right, let's see. I wonder if I can switch over now to Rima, if I share my screen and talk about this upcoming class that is going to be happening. So just one second, I'm going to share my screen so that I can show people what we're talking about here. And I tried to find this information on whoops, yeah, that's the one I want. Are you guys seeing sign language class real big on your screens there?
Yep, we see it.
Perfect. Yep. And so, Rima, what's this all about?
Sure. So this is very exciting. So this person went ahead and took the class, and it's for anybody, any providers that want to learn sign. This is free. So we've got, it was a great opportunity to have a class. And they can reach out to Cheryl. I think there's an email there. Cheryl Essen, her email's there.
So I cannot copy and paste the email. So Zach, can you grab that and put it into the chat?
Oh, no, I'll put it in the chat. That's fine. Yeah, I can put it in the chat.
Thank you, Rima.
Sure, no problem.
So I know we sent this out to client services managers, hoping that they will share it with.
Yeah, thanks for sharing that. Yeah, it's for all classes. If you can't, I suggest you try to leave a space for others who can go. But it's an amazing opportunity. So if you've got a client that wants to learn sign, any staff, anybody really is open to anybody and everybody. When you email Cheryl, ask for which level that you might need. Is it beginner or is it more of an advanced? So I think most of everybody would probably be a beginner. Email, let them know that you need a beginner class. They'll send you a Zoom link. And I'm really excited for this opportunity. For those who need Spanish, you can make a request for Spanish interpreting. So that's another amazing opportunity as well. This is just awesome. Thanks, John.
Excellent. Rima is very good about putting forth resources for us to share. And so, and obviously we like to be able to share these things here at our Coffee with Community. I certainly will have a special place in my heart for any of our staff that decide that they want to participate in this training. I appreciate that they're doing it after hours as well, to allow people. But I mean, this is going to continue to be a very big push for the developmental disability service system, services for individuals that are deaf or hard of hearing. And with that, having the key to be able to communicate with individuals available to you certainly can make yourself more effective in serving this growing population of individuals in our area. So definitely want to encourage our staff that want to do it, and certainly want to encourage our service providers that may be interested in doing this as well.
John, can I just touch on, I spoke with Cheryl yesterday. I actually signed up because I'm excited for it. It is every Wednesday. So every Wednesday for the month of February and through March, from 5:15 to 6 or 6 to 6:45. So just let you know, planning wise, they're every Wednesday. And she will send a link within a week before the meeting.
Again, an excellent resource. And then there's another thing I wanted to talk about really quickly, and Rima can, I think, help me out a little bit with it, and I'll ask her to in just one moment. So we also have a CPP plan that we have submitted to the Department of Developmental Services. And some of you may be aware that we have requested support for 2 more multifamily housing projects. One of them in the Grass Valley area, just a little south of town, and then one of them in the city of Woodland as well. And so I will share that the Department of Developmental Services has not made the award determinations yet. And so we do not know if we are going to have an opportunity to develop those, but they did have some additional questions for us related to one of our projects that we are looking at doing. And so this is something that is a new Department of Developmental Services priority for the Community Resource Development Plan, Community Placement Plan funds money. And basically this is money that every year the department sets aside for special types of projects. And this last year they've said, we are going to expand the types of things that we award to support more services for individuals that are deaf and hard of hearing within the regional center system, which is great for us, for them to expand the types of services that we can propose. And so I'm going to go over this real quickly, what our description is. And then for the registry, I'm hoping that maybe Rima can share why she feels like it's so important. So real quickly, interpreter service. So this would include an ASL and deaf interpreters in the category of interpreters. Part of the startup funds would be used for the awarded applicant to recruit interpreter staff in our outlying service areas and provide them training on providing services to clients with developmental disabilities. So again, we certainly hear from this meeting. It's one thing that's beautiful about Zoom is that it expands our reach and our ability to connect with our service providers that are outside of the Sacramento metro area, where sometimes it's a little bit easier to get resources. But we certainly hear from the Grass Valley area, the Truckee area, the Placerville area, about service challenges that exist because of lack of providers. And so again, you know, individuals throughout our, I think, Rima, at one point we said that we have 1,500 individuals possibly at our regional center that are deaf or a lower hearing level. And with that, you know, I know there's a lot that's being done from the deaf and hard of hearing specialist group about some changes that we can make to better capture who the individuals are with developmental disabilities that are also part of this population. But in the meantime, we know that they're there. We know that there is service needs for them, and reaching out for an interpreter service that can also hopefully focus on our outlying service areas, I think is a great idea. And so, and the other one is a signing staff registry. So I'm going to read the description real quick, and then I'm hoping that Rima can just give us a quick little feedback about why it's important. So recruiting individuals that can sign but do not meet the qualifications to be a certified interpreter. Signing staff are either deaf or hearing and know ASL, but does not have specific training. A portion of startup funds would be used for the awarded applicant to recruit staff and provide them training on providing services to clients with developmental disabilities. With a developed staffing registry, in collaboration with the awarded applicant and our deaf and hard of hearing specialist, the individuals could then be referred to vendor programs needing to hire signing staff to work directly with deaf and hard of hearing clients. So if the pilot project is successful, ACRC could explore requesting additional funds in future year plans. So Rima, why was it important for us to ask the state of California for money for a project like this?
Sure. So what I've noticed is that many of the deaf clients, they experience severe isolation, meaning their peers, they don't have peers who are like them. There are no staff that can communicate with them. There are communication barriers that they face every day. And a lot of vendors have asked, do you know anyone who signs? Do you know anybody that we can get? And I'm thinking, how can we solve this problem? So we came up with a registry plan. So if it works, then we can provide more support for the vendors that are able to have signing staff and interpreters, with the goal is to provide communication access for all clients on a consistent basis to combat the isolation. So people need communication, they need access to communication, and it's an amazing opportunity, and I'm really hoping that this gets funded.
Thank you very much. I did not really work on these at all, which is a very big change. I'm used to writing all of these proposals, almost every word of them. And so it is amazing to have staff that are able to be creative like this and be able to come up with these types of pilot projects. These are not the $2 million big housing project type of things that we do. You know, these are $10,000, $20,000, $30,000 smaller pilot types of things. But again, you know, this is us trying to be as responsive to our community as possible and leverage as many dollars as we can to try to be innovative. And you can't be innovative unless you are, I think, really a subject matter expert in things, or you can access a subject matter expert on things. And so, you know, Rima can speak better than anyone else to the ability for an individual to be isolated in their workplace and not have people around them that speak their language and are able to communicate easily with them. So I just really appreciate taking everything that you know about the challenges that are being faced by the population in general, and then also making it very specific for individuals with developmental disabilities as well. So again, I am really hopeful that you're very welcome. That I'm very hopeful the department chooses to support this project. So we'll update folks on that and how it's going. And I will go. Let's see. Let's see. We are going to go over to. Oh, I have to go to Alicia real quickly. Oh, we've got some questions here. Alta used to provide interpreters through Eaton Interpreting to Our Day program. Does that mean that we no longer have a company providing interpreting services? We've been without an interpreter for months. I think Rima probably is pretty familiar, and so is Helen, with the status of our interpreters. Helen, Rima, do you guys want to kind of talk about the status of where we're at?
Sorry, this is the interpreter. I'm looking for Rima.
Say it again, John. Sorry.
Yeah, so in the chat, there is a question related to Alta used to provide an interpreter through Eaton Interpreting to Our Day programs. Does this mean that we no longer have a company providing interpreting services? We've been without an interpreter for months.
Yeah, we are continuing to work on looking for providers in the community that are willing to accept right now the issue is the reimbursement system and the cancellation issue. And so REMA actually worked with us, with community services specialists, in vendoring. I think it was language access, and so we will continue to do that. We will also continue to work with the previous interpreting company that we had that stopped the service because of the cancellation issue. But yes, that is on our radar. That is, we're working on it still. Right.
Yeah, and again, this is REMA. Right now, we have interpreting services with an agency. We have Access Language. If you need an interpreter, go ahead and ask the interpreter coordinator for that service. That agency will provide an interpreter.
All right, and again, this also speaks to the importance of this community resource development plan request to the Department of Developmental Services, because we certainly need to ensure that we have both interpreters, but also signing staff that can be available for our clients. It's a range of different services that are needed. It's not really just one thing, because people have different types of needs. So very good. Thank you very much for that update. I want to jump over to Alicia for HCBS.
Good morning. So we are making some strides with HCBS. Every week, our compliance numbers are going up, which is great news. We had big turnout yesterday for our workshop that we had, and everyone who attended the workshop, all 22 vendor codes, were those high scrutinies. And most of them have submitted documentation to be reviewed as of today, which is wonderful. We have 2 people working full-time reviewing documentation. So if you've submitted something November, December, January, you will hear from me by next Friday for all 3 months of those submissions. Those will all be reviewed. We also have a number of reviews that DDS did, and I'm going through and replying to providers one at a time. So you may get an email stating that you still need some fixes to stuff that you submitted in June, July, and August. So I will have those to you in the next 2 weeks. We have more workshops coming up. I'm holding one-on-one office hours every week. We have some vendor forums. So if you need support with HCBS documentation, we have plenty of opportunities. I will put the HCBS email address in the chat box. Feel free to reach out to me. Even if you don't know where you stand, if you're just like, I don't know if I'm compliant or not, it's not bugging me for you to just reach out and ask me, and I will let you know what needs to be done. I think we got about 40 compliant last week, which is great. We're down to 320 to make compliant. 2 weeks ago, the number of people who hadn't sent in anything was 140, and that number is now only 87. So only 87 have not submitted, and of those 87, I'd say at least 30 of them have met with me at office hours, came to a workshop, or are working on documentation. So the last piece is that we have contracted with Progressive Employment Concepts, PEC, and they will be knocking on doors and making phone calls to those providers who have been non-responsive, who are in high need of support. So we'll also be providing their liaison information when we contract for each provider, so they know which homes we're going to. So PEC may reach out to our liaisons to work with them to even go out to homes to knock on doors to get documentation done. And the first 10 of those reviews will be out, or 10 referrals will be out today.
And share with folks the importance of the work that Alicia's doing and I would say, kind of the pressures that are tied to that particular position. Alicia's had the pleasure of meeting twice in the last 2 weeks with the Director of Developmental Services for the state of California, because we are now having weekly meetings with them until we get to a point where I think we're done here in March. And so, yes, Alicia, having just transitioned to this position recently, is explaining all of her work to Nancy Bargman, the Director of Developmental Services, every week, along with our Executive Director, Lori Benalis, myself, Michelle McDonald, and DDS's other staff that are working on HCBS. But that's quite a lot for someone that is brand new into a position to have to be explaining basically every single aspect of their job duties to the Director of Developmental Services. And I cannot give Alicia enough kudos for what she has done and how confidently she is able to express where we're at and what still needs to be done. And so just really pleased to see the work that everyone is doing. I know it's a lot for the service providers as well to go through all of that. A lot of specialists have spent time, trying to get things squared away. So again, just kudos, Alicia and Michelle, for all the work that you guys are doing on the HCBS stuff. I love these, bringing people in and having people in our office and going over. I believe that, that's helping overcome a lot of the concerns that people have about being able to do this statewide. It is very consistent. It's typically arm level providers that were with the regional centers since the 80s and 90s that have typewritten program designs, many of them, that are really holding up the rest of it for the state of California as far as being responsive. One thing that is very nice, and they certainly wish DDS would have come out with it quite some time ago, was a very easy program design addendum that can be utilized, to, in essence, update a program design with a very short document that will allow someone to come into the compliance. And so very happy that they came out with that, and everyone wishes they would have done it quite some time ago. So with that being said, very good for the updates there for HCBS. We also know that people that attend a weekly vendor meeting probably are not the ones that haven't done their HCBS yet, though. So as to residential, we sent out a survey a couple weeks ago related to all of the COVID-19 1 to 3 supplemental staffings that we did. And so far, I believe we had about 100 responses back or more from service providers. And I know when I looked at it, 89.7% of the residential service providers said that they still needed to retain a 1 to 3 supplemental staffing within their care home. And again, I think this is related to continued individuals that may not be attending full-time day programming again. But now, it's going to be kind of the responsibility of our facility liaisons, the service coordinators, to really check and see whether or not that supplemental staffing is going to end up being needed. And then we'll be switching over for those that are really needed, because we developed a COVID 1 to 3 kind of subcode for all of these, and that's why we implemented them. But the 1 to 3 service code or subcode has always existed. We just never used it as our regional center, or very infrequently ever used it. And so I don't think we ever did. And so we can use it again, but we just need to verify with service providers. And so just want to give a shout out to all those residential service providers that already responded back. It was a very short and easy survey, and now we've got a good head start on figuring out, who has the supplemental staffing and who still wants it moving forward. And for those that haven't responded back yet, we have the list of all of the providers that currently have them, and so that'll kind of be the next step. Is we're going to have to reach out to those providers that didn't respond back to the survey to see whether or not they still, because under no circumstances do we want to look at canceling authorizations without being clear about whether or not they need possibly to continue on beyond the end of the COVID state of emergency. So I know that's a lot of residential stuff, and there's probably less than 10 residential providers on the call right now, but many of you day program operators are impacted by residential, many of, the transportation providers, many of the other folks that are on here as well. And with that, on the residential side of things, I had the unfortunate, unpleasant duty of sending out an email to our facility liaison supervisors about 3 of our providers that had to do large repayments because of failing to pay overtime. And Christina, we've been talking about this for so long. This is one of the reasons why, we used to, and I don't know if you guys still do it, but, those 7 a.m. Early morning, go out to all the homes at once and then go out to the day programs and see who's working at the day programs and see who's working at the homes. But, providers get nailed for this. Having, one staff person go work at your 3 different homes and not giving them overtime because they're working at 3 different places, you can't do that. You can't work people these 24-hour shifts or 16-hour shifts and not have them pay overtime. So anyways, we had, unfortunately, as I said, one provider that had a huge repayment and another couple that had smaller repayments. And we really don't want to ever hear about this, where the workforce that is always so hard for us to find anyways, aren't getting paid for the work that they're doing for providing typically services well beyond, when someone would start getting exhausted for working, and they're not getting paid the overtime funds. And again, if you're a residential service provider and you're thinking like, oh no, I can't afford this overtime or whatever else as it relates to it, please make sure you reach out to the regional center about that, because that's certainly a talk we can have. Michelle, yeah, go ahead.
Yeah, I'm just curious, you said repayment. So did they have to repay the regional center? Not that it's any of my business, but
no, it's it goes through the feds. They handle it.
Okay.
Yeah, no, it doesn't. Yeah, no, it doesn't. It was a finding by the U.S. Department of Labor. I shout out to Isabella, who I don't think is on here, one of our community services specialists, who's been kind of doing some continued correspondence with them as well at the U.S. Department of Labor. So again, it's just something that we never like to see it, because we know how hard it is to get and keep DSPs, and to hear about them not being paid for all that work that goes on is really rough. And so, and again, it's, 3, what I would consider, of our better residential providers. We've got good residential providers, but sometimes they make mistakes with bookkeeping and things like that. So all that being said, just wanted to kind of keep people in the loop about that. One last thing, because I know we did a training on it for our staff as well. Coordinated family support services. I know there's been questions asking about it. There is nothing decided yet as far as what exactly that service is going to look like. The rates have not been decided yet. This is services to help provide supports for people that are going to be possibly living with, their family members for longer periods of time. It's an alternative. I don't like using the word alternative. It's a different way to be able to pay for supportive services in the home. But even like what the hourly rate is going to be still has not been something that has been shared. And then real quickly about sharing, did we share that Jason is going to be the new lead in community services? I don't know that we did. Let's say congratulations to Jason Scantleberry, that he is going to be our new lead community services specialist. When does that start?
We're waiting for a replacement for my current position first. So
everyone apply to work in community services so Jason can start his new job. Now, many of you service providers have reached out to me and talk and have worked with Jason, and I just consistently always hear such positive things, and I have always have fantastic interactions with Jason since he's joined our department. So I think he is going to certainly be an aid to Helen and Michelle, which that's going to be a big part of this lead position. And obviously he brings his experience working out in our community, but then also working as a service coordinator as well. And we want to be just one agency and be able to be really on the same page about things. So it's very nice to have, someone with that service coordinator background as well. We've got it, in a number of different areas within community services. So congratulations, Jason. And with that, I will say, I hope everyone has a great weekend. Some of you I will see at the SLS Vendor Forum, I think, which is next week. And, reach out to your specialist if you specifically have questions, especially on the transportation side. If you don't know who your specialist is, Helen's got her contact information in there right on the side. And we do want to take time and an opportunity to explain these transportation monthly reimbursement rates to you. Okay, have a great weekend, folks. Thank you very much.